And my policy project is on improving breastfeeding rates among WIC participants. So the policy recommendations for enhancing food package incentives and breastfeeding education. First, what is WIC? So WIC provides supplemental nutrition, health education, and breastfeeding support to low-income women and children. And then, despite revisions in 2009 to improve breastfeeding rates, low-income mothers continue to rely on formula feeding due to various barriers. And then, my goal is to improve breastfeeding outcomes by enhancing food package incentives and strengthening breastfeeding education. So next, I'm going to list out some of the problems that we're facing within WIC. So barriers to breastfeeding. So 2009 WIC revisions aim to increase breastfeeding, but barriers still persist. Access to education. So variability in effectiveness and access to breastfeeding education based on region and population. Then the lack of education, which leads to poor infant health outcome, and increased formula use. So then public health concern, low breastfeeding rates can contribute to long-term health issues like obesity, diabetes, and development delays. WIC serves about half of the U.S. infants, so providing breastfeeding education could have global benefits for health outcomes. And then challenges for low-income women. So there's barriers include lack of lactation support, workplace policies, and cultural behaviors. So stakeholders and perspectives that are involved. So WIC participants desire better support, more food, and access to lactation consultants while balancing job constraints and cultural norms. WIC administrators aim to improve breastfeeding rates and reduce long-term health costs. Health advocates support breastfeeding for health benefits to mothers and babies. And then formula brands, they oppose breastfeeding promotion due to potential loss in revenue. So then recommendations for policy improvements. Enhanced food package incentives, which we would increase the variety and quantity of food for exclusively breastfeeding mothers, include more culturally appropriate foods to address diverse populations. Strengthen breastfeeding education, so standardize breastfeeding education across all WIC offices. Increase availability of lactation and peer counselors. Ensure WIC staff are fully educated on all breastfeeding benefits. So literature review and existing policies. Like we said before, WIC food package change in 2009. The revision aimed to promote breastfeeding, but breastfeeding rates still remain low as of today. Some of the challenges that we face are the financial and cultural barriers continue to affect breastfeeding rates. Then the goal that we strive for is studies show that enhancing education and providing support can improve outcomes, and then increasing food package incentives and cultural tailored foods can also support breastfeeding practices. So the policy option number 1, so the impact of public health, which we would track breastfeeding initiation and duration of the rates, then monitor infant health outcomes and use surveys to assess the changes, the feasibility, assess the WIC office's capacity to distribute enhanced food packages, and then gather feedback from the participants to understand cultural satisfaction. Then the fiscal impact, compare cost of enhanced food packages with the previous, and then analyze long-term healthcare costs, savings with improved breastfeeding outcomes. Now onto policy option number 2. So the impact of public health, track changes in breastfeeding rates and associated health outcomes. use data from clinics to assess health impacts, then the feasibility, evaluate WIC capability to expand breastfeeding support systems, conduct surveys to assess WIC staff knowledge and identify training needs for those staff members. And then the fiscal impacts, calculate the cost of hiring lactation consultants for every WIC office, and then estimate cost savings from improved breastfeeding rates in healthcare. So, in conclusion, despite the 2009 policy change, breastfeeding rates still remain low within WIC participants. The lack of adequate food package incentives and inconsistent breastfeeding education can also contribute to this problem. The cultural and economical barriers play a significant role in these low rates in breastfeeding among these WIC participants. And so that is all I have for today. Thank you for listening. And here are my references at the end.